Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging.
Hi, we're here today to answer one of the most common questions we get, which is how do you know if it's dementia? What kind of evaluations are you supposed to get to determine that? And Dr. Leatherman, when patients and family members ask you, isn't there some specific lab test or brain scan that can determine dementia? How do you answer that question?
Well, there are a lot of new technologies and procedures and information coming out all the time about how to diagnose Alzheimer's and how to evaluate dementia. But there's no one test that differentiates all of that. It's important to see somebody who knows about the disease, and there are many specialists, but before you do anything, you need to go to your primary care, family physician, or internist and have a complete medical workup. Tell those specialists, your family practitioner, your internist, your concerns about memory problems, behavior problems. Let them do a full evaluation, and that would include lab tests, a physical examination, cardiac workup, because many physical illnesses can mimic dementia and look like it, but they're possibly very easily treatable.
So that's the first step, and then your doctor may refer you to other specialists like neurologists or psychiatrists
or neuropsychologist
for a more specialized workup.
Well, what kind of a workup might a neuropsychologist do?
Well, as a neuropsychologist, that just means I'm a psychologist, but I have some special training in how the brain works. And the tests that neuropsychologists give are paper and pencil and oral question tests of memory, thinking and reasoning, speech and language, a number of different brain functions. And because the tests are standardized, we can compare the patient's results with people their age and education. And that gives the doctor some measure of how the person is doing. You know, a neurologist once told me that a neurologist can open the hood of the car, so to speak, and make sure that all the parts are there, meaning he's looking at the brain from a brain scan. Can tell all the parts are there, but the neuropsychologist has to get in there and start the engine to see if it runs and see what kinds of knocks and rattles are going on.
Well, and a geriatric psychiatrist often functions as almost a behavioral neurologist, looking at how the parts of the brain that don't work affect behavior and thinking and cognition. But the message we really want to leave with you today is probably threefold. The first thing is don't wait. If you have problems, if you see problems in a loved one, go to your primary care physician. The second thing is get a full evaluation. Get lab tests, get a physical examination, and be honest and open with your physician. And the third thing is if you don't have an answer that works or that seems to make sense, ask for a referral to a more specialized expert.
We hope this helps because dementia is a very scary thing to think about.
And it's complex.
It is. So you really do need expert assistance. Well, thanks for listening to us, and we'll keep answering questions with each one of these programs.
Bye. For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.